Hi, I'm Dr. Stephen Dorn, and welcome to the medical segment of Western Wisconsin Journal. I'm a family practice physician in Hudson, Wisconsin, and welcome to the show. Today we're going to talk about your information, your health information, and who has access to it and who doesn't. And this is in light of a recent case in Minnesota. We're going to talk about protecting your healthcare information today. Recently, the Minnesota Attorney General brought a lawsuit against a Minnesota company, well, it may not be exactly a Minnesota company, that had a computer stolen from a car. The computer contained over 23,000 patients' unprotected personal healthcare data. It's about maybe their ages, maybe some of their conditions. The company is called Accretive. It was employed by Fairview and North Memorial Health Systems in a somewhat of an accounting role. The lawsuit is also concerned not only with the stolen computer, but what was on it. And they're concerned with why Accretive needed the type of information that they had and how it used and distributed the healthcare information. In 1996, President Clinton signed the HIPAA bill into law. HIPAA stands for Health Information and Portability Act. That's kind of a mouthful, that's why they call it HIPAA. The law encompasses standards for the privacy of individually identifiable health information. Besides the previous breach of patient confidentiality, there was a few years ago another stolen laptop computer with over 500,000 Veterans Administration patients' confidential information on it. Another incident was in July 2007 when Park Nicollet Clinic, which is in Minnesota, fired over 100 employees for using the computers to access other people's healthcare information. They were basically snooping. Today, as our guest, we have Steve Kronmiller. Welcome to the show.
Thank you.
Steve is our technology information person, IT person at the clinic, and we have three of them, and he's the leader. And how long have you been with the clinic now?
I just finished my third year.
3 years, all right. And we've had our computers up and going for how long now?
Well, we implemented a new electronic health record system in August of 2010.
Okay.
So just about a year and a half.
All right. And I bet you had a lot of preparation before we put that computer system in.
Well, one of the reasons I was hired in 2009 was to help bring that system in. So it's been about a 3-year process.
Okay. And what's your background? How did you get to be so good at computers?
Well, I have a degree in computer science. I've been practicing in that field for over 30 years. I worked in regulatory bodies most of that time, a couple of years with Citicorp, one of the world's largest banks. I spent 15 years with NSP developing systems. I was a consultant at Target with some of their PCI compliance, which is security-related work. And I spent some time at the Osceola Medical Center running their IT department.
You've been in many places. Where did you go to school to learn this?
Winona State.
Okay. All right. Well, good. Well, why don't we get right into some of the questioning here, Steve? All right. Who has access to a patient's health information legally?
Legally, anybody who is involved in your care. So you as a patient, obviously, it's your record, so you have access to it. Mm-hmm. Your provider and your nurse team have access to it.
Your provider would be your doctor.
Your doctor and your nurse.
Sense.
Anyone who's directly involved in your care. But then there are other people as well, like anyone who needs access to that information for billing purposes. So we have people on our staff who code the bills. We have an insurance team that processes those insurance claims. We also have people that we have to send those insurance claims to, insurance companies themselves. And then every once in a while we have to involve the legal authorities if they ask for it as well. But that's basically the only people who should have access.
Should have access. So let me get this straight. So in order to get paid, we have to tell the insurance companies what we did.
Yep.
And what the diagnosis was.
Yep.
And that type of thing. So that has to be passed on to them to justify what we did and get paid for it.
That is correct.
Okay.
So they have a legal right to know.
It's kind of not a real lot of people. So who does not have access to someone's healthcare information?
Anyone other than the group that I told you. If you say you don't want your information disclosed, or you don't say that you do want it given to somebody, it can't be given to them.
Okay. So, I mean, it could be somebody even as close as a spouse.
Oh, that is absolutely correct. Yes.
Right.
There are oftentimes children are a good example, and spouses are a good example. I don't necessarily want my spouse to know that I came in to be treated for something.
Okay.
And so you can't tell her that I was even in the clinic. Children, oftentimes they want to come in and they have STDs or whatever, and we can't tell their parents. So we have to be very careful with what gets disclosed and what doesn't get disclosed.
Well, it's kind of interesting because if you have a 16-year-old girl with a sexually transmitted disease,
parents want to know those things.
They're still under 18, so they're not independent because that's the cutoff.
That's right.
Once you're past 18, your parents have no access to your records.
Mm-hmm.
And so somebody's 16, and yet they're doing adult-like things to get sexually transmitted diseases, and yet they don't want to have that released to their parents.
It can be a problem.
It's a problem. It's a dilemma.
Yes, it is. Especially when the insurance company is being paid by the parent for the policy that's probably paying for the service.
There you go. So if you find a sexually transmitted disease and you're trying to contact a child,
contacting people at home for about appointments or any other reason can be a very tricky thing, because it's a breach for us to even tell somebody that you are in the clinic. So unless you tell us specifically that we can call you with a reminder call and leave that message on your phone, we can't do that.
oh, so those messages that we get the day before saying you have an appointment the next day, you had to approve that already.
That is correct. Yes.
Do you sign something, or?
We have a release of information form. It's a very standard form that we give to everybody. And like most legal forms, everybody doesn't always read every little fine print in it. But that form spells out what our responsibility is to you to protect your information. And it also authorizes us to disclose information to the insurance companies and to contact you by the phone. Now with technology, we're starting to look to see about contacting you other ways, through email or text messages or any other form. But all of those communications have to be approved by you in advance.
So the first time you go see the doctor, you get these forms and you sign them for those kind of releases there. Well, it still stuns me, when it comes to family matters and releasing information to families. And
It can be a problem.
And so if Mrs. Jones has a high potassium and it's very dangerous and she needs to get to the hospital right away, and Mr. Jones answers the phone, and I'm going to say, is Mrs. Jones there? No, she's not. Can I take a message?
Oftentimes we can't say any more than
We
that.
say, you know what, she's in big trouble. You got to get a hold of her. She needs to go to the emergency room, but I can't tell you why.
Well, we can't even really say that.
And you can't even say that.
No.
So even if it's an emergency, you're not
That is
supposed
correct.
to release information.
That is right. That's why patients really need to think about that when they come in, and who they want to have access to their information. And I think it's really important that you authorize your spouse, for example, to have information shared with. Otherwise, we can't do that.
Well, it kind of goes for the elderly too.
Yes, it does.
Because they don't always remember what happens when they go to the doctor. Sometimes they go with their son or daughter, and they probably need to have sign something so that their son or daughter can receive some of this information.
Well, there's a lot of There's a lot of talk about that in the community, and there's advanced health directives, there's powers of attorney, there's medical, I forget what exactly the term is, but there are documents that the elderly can prepare in advance of having issues, where they say, if I become incapacitated or if there are certain conditions that occur, then it's okay to I authorize this person to act on my behalf and have information released to them. And so it's really important that elderly in particular take advantage of that.
Can the older person verbally say, you can release information to my daughter?
If it's done face-to-face at the time. So like if the elderly person has their daughter and they're seeing you, and you know because she said, yes, you can do this, you've proven that the person authorizing you to release the information is authorized to release it.
Right. But is that just for that one occasion?
Yes.
Or what about if you need to call somebody?
No, it would be for that one occasion.
Just that one occasion. So if you have a family member who, when they go to the doctor and you go with them, you better sign some kind of release of information so that the daughter can get the information.
In the future, yes.
In the future.
Because you're not going to be, the parent isn't always going to be there to say this, yes, I am authorizing the release of my information. So what proof do we have? And it really gets into the legalities, and that if I release information about you and you sue me saying I shouldn't have done it, how can I prove that I was authorized to do it?
Do that.
So the way we protect ourselves is with these legal documents. So you sign a document that says, in the future, you can give my information to my daughter.
It's very rigid.
Yeah, it's a shame we have to do that, but we've kind of gotten to a point where people will sue over anything, and with all these breaches that are going on out there, who's going to blame them?
Really? All right. Now, we do a lot of things in the clinic to prevent a security breach in healthcare information.
Yes, we do.
Can you give us some ideas of what we've done in the clinic so that we don't give out healthcare information or it accidentally gets out illegally?
Yep. Well, the basic tenet is called access controls. And there are two kinds of those. One is physical controls, which means you can't physically touch or get access to the information. And the other one is logical. So in terms of physical, we don't have computers with your information just laying around in the lobby. There is always somebody nearby making sure that people aren't touching or getting access to the machines that aren't authorized to. We don't let vendors or unescorted guests go walking through the facility. Those are examples of some of the things we can do. Other things we do is we position monitors so that when walking by them, you can't see what's on it. I can't see the patient's schedule and find out that, hey, my neighbor's wife is coming in this afternoon for a visit. It's not available. Or we put screen protectors on top of it so that it obscures that view.
So screen protector, so if somebody's kind of off to the side, they can't see it.
Exactly.
You have to be right in front.
Right. Okay. And then from the logical perspective, we have IDs and passwords. Everybody who has authorization to use the system has their own unique ID and password. And it's important that they're unique so that I can't do something under your name, because otherwise you would get blamed for it. Anybody who doesn't have an ID and password can't get into the system. Our HR department helps us with that because they vet our employees. They make sure that before we hire them, you are who you say you are and you can be trusted. And when we hire you, you sign a confidentiality statement that says, I'm not going to disclose any information. Again, some protection for us in case you do. And then we give you an ID and a password. And you have to change that ID and password at least every 90 days. So that if I figured out what your password is, 90 days later, I'd have to do it all over again. And it's not worth the trouble. We also extend that to vendors and contractors. So we have a cleaning service that comes in at night. We have an agreement with them also that says they will not, and none of their employees will, disclose any information that they happen to see. So we try to protect ourselves legally. And then we also do other things like, I know we implemented an electronic system, but sometimes we have paper charts laying around, and sometimes we have x-ray films, for example, that come in. Well, we make sure that those things are always laid face down so that the patient's name and information isn't exposed to somebody who's casually walking by.
What happens if somebody steals one of our computers?
That really shouldn't be a problem, because what we've done in our system is anything that you would save on your computer, you say, I'm going to save it to my documents. Well, our security is set up in such a way that your My Documents folder isn't on your computer. It's actually sitting in a server in a locked room elsewhere in the clinic. And we also, with the records, with our electronic medical records, is hosted in Cerner, by Cerner Corporation in Kansas City. So those records aren't even physically here to steal. They're not even in the building.
They're not in the computer, they're not in the building, they're in Kansas City.
That's right. We also are working with getting people to working from home and allowing them to have a more flexible lifestyle. And the equipment that we're deploying there prevents them from printing any documents. If they say print, it prints back in the clinic. It's the only printer it knows about. And there's nothing, it's called a thin client. There's no hard drive, there's no moving parts, there's nothing to save. The only real risk that might be there is if you're letting your kids play video games and watch you on your screen. But we do random audits and walk-ins to make sure that we're not doing those things.
So when I'm using my computer at home and I access Cerner, which is our server, I'm accessing Kansas.
You're accessing Kansas.
And it's not leaving anything in my computer that people could steal off of.
That's correct.
No information.
Yep.
All right. And I noticed all our computers are locked.
Yes, they are.
They're bolted in.
Yes, we did.
So we can't put them in the backseat of the car where they could be stolen.
Yes. Well, and that was, we didn't want the computer to walk away. There's no information on it that is worth anything.
Well, in some of these cases, the information was in the computer that was in the car. And our computers don't have that information. If you walked out with one of our computers, you couldn't get access to that information.
There would be no information to be found on that machine.
Amazing.
We try hard.
Amazing what you have to go through. So that sounds like pretty good protection.
We do what we can. Security is a lot of different things. Just doing one thing by itself doesn't make you secure. So we're very busy.
Well, we know that. Especially when it's hard to find you. Okay, the government's been pushing computers. And of course, we're talking about security here. But why is the government pushing computers so much in the healthcare industry for information?
Well, there's a lot of reasons. And when you look back at HIPAA, Health Information Portability and Accountability Act, the accountability is very important because what it was intended to do was to allow you as a patient to be able to go from clinic to provider and take your information with you. And in order to do that, it had to be secured because it's now out in the open. And so they want to allow that to happen. They want it to move, but they also want to be able to start reducing the cost of healthcare. And in order to do that, we need to be able to have all of these providers know everything about you that I might go see. I might see 10 different providers. If I walk in and I cut my finger, you give me a tetanus shot, because I don't remember when I had my last tetanus shot. 6 months from now, I'm out on vacation and I get another cut. So I go see that provider and they give me another tetanus shot because I can't remember if I had it. And I can't tell you how many times we've paid to have someone get a shot that they didn't need, just because we didn't know when their last one was. And so by creating electronic records and sharing these records amongst the medical community, we can reduce the cost by not doing things that aren't needed.
So how does somebody, they're not sure about when their tetanus shot is, they live in Wisconsin, they're in Colorado, and they get cut. How does the Colorado clinic access their information here in Wisconsin, or their clinic here?
Well, today that's a little hard to do.
Okay.
But it's being developed. There are some things that we can do in between now and then, because right now there's a term called interoperability, and that is where one clinic's electronic system can talk to the other clinic's electronic system. There aren't a lot of clinics doing that today. But what we are doing until that comes about is we're working on a project right now so that our patients will be able to go out to the internet and look at their own records. And so if you are on vacation and you get hurt, you could log on to the system and give that provider your records by going online and getting it yourself. Now, not everything is going to be there, but a lot of the things that are important like that should be.
I know some of the healthcare organizations have something like that going right now, where you can
Some
look
of the
up
large healthcare systems
your results.
with lots of clinics and lots of providers that have been figuring out how to share it amongst themselves, and they've got a big step ahead of the game. But the large healthcare systems don't necessarily talk to the other systems.
The other systems.
You know, Health Partners may have a great online system, and all the Health Partner clinics can access it, but does that system talk to Allina? Does it talk to us? We're not there yet.
Or the university or something like that.
Yes, exactly.
Well, that's interesting. Well, I know the hospital, Hudson Hospital, has a different server or system than we have.
That's correct.
They've got Epic, and we have Cerna, and they don't talk to each other. So it creates a big problem.
Yes, it is. And that's one of the challenges that we're trying to tackle this year, is how we can make those two systems talk, at least in a way that we are providing the patients in the community the kind of care that we want to be able to provide.
Gotcha. So it sounds like we want to reduce cost of medicine by using computers, not doing tests that have already been done or giving shots that have been already done. Don't you think that the government in some ways is setting the industry up for a change in the way healthcare is paid for or monitored? For instance, those who do cheap quality care will make more money. Those providers. Is that going to happen?
I think they're trying to do the opposite, because I think today the healthcare system and the payers we're getting reimbursed based on every test that you perform, whether the test is needed or not. And there are some providers out there that'll order every test they possibly can to get more reimbursement. I don't believe any of our providers are doing that, and based on the quality measures that we've been seeing over the last few years, what we're finding more is that payers are trying to shift that paradigm and stop paying for individual tests, but to start paying based on outcomes, quality outcomes. So the better you take care of your patient population, the more you get paid, versus the more tests you run, the more you get paid.
So instead of, fee for service, or what you do, it's going to be fee for quality.
Right. The system we see today, we have the fee for service system that's been in there for years, and we've all gotten used to. But we also participate in several quality initiatives that reimburse us at the end of the year for achieving certain quality goals. What I'm seeing in the industry is that's going to switch. There's going to be more emphasis on paying for quality and less emphasis on paying for fee for service.
Okay, so what about like procedures? This procedure was unnecessary, or is that going to happen, or?
I don't know. Today there's a thing called medical necessity, and it primarily affects the Medicare and Medicaid population. And the government has basically laid out some rules that says, based on scientific evidence, based on outcomes that we've seen across the United States for a number of years, you only need to perform certain tests on a certain frequency. You know, so if I say I'm going to pay you to perform a test once every 2 years, because doing it any more often than that doesn't give you any better information to treat the patient
Or
by,
any better outcome.
or any better outcome, then if you order it every year, the insurance company isn't going to pay for it every year. They'll pay for it every other year, and that means then that the patient right now is stuck having to pay for it, or the provider having to take a write-off.
And by having access to that information through electronic health records, the insurance companies can access that and deny payment.
That is correct.
So it's like somebody's watching over your shoulder.
Insurance
Almost-
companies
oh,
have been
they-
doing that
they
for
do
years.
that anyways,
Yes,
right,
they are.
right.
Yeah.
Well, you know, it's interesting because we're doing some of that now in terms of Medicare will not pay for like mammograms if it's less than a year.
That's correct.
So the people have to wait till that year is done since their last mammogram before they get the next one. They do it earlier, then somebody doesn't get paid.
Yep. And they actually say 12 months. So if you did it 11 months, even, 'cause we run into that a lot. Well, I had one in 2010, and I had one in 2011. I had one a year, right?
But it's only 11 months.
But it's only 11 months. Exactly.
That's interesting. Not everything can be kept private. There's going to be some breaches. Does the HIPAA law allow for breaches in medical information confidentiality?
Well, we have to have incident response plans, they're called. And so what that is any time that someone's information is disclosed without authorization, we have to track it and we have to report it. Now, most of the time there are innocent mistakes made or minor infractions, so to speak, and so we don't get penalized for those. But the more recent legislation that came out and enacted this last year are toughening those penalties. For example, if you have a breach that impacts more than 500 people, you've got to let all the local media know that you had a breach of that magnitude.
Big news story.
Big news story.
Yeah.
So you want to avoid that. And that could be a very simple thing, like you're doing a mass mailing and somebody lost an envelope and everybody got put in the wrong envelope.
The wrong addresses.
The wrong address. So if we mailed your lab result to me and my lab result to my neighbor and so on, every one of those is considered an individual breach. Now, we have to notify the patient who was affected by it. And then if there's more than 500, we have to notify the federal government and the media. And then, depending on how severe it is or why it happened, we can have some fairly significant penalties imposed.
Okay, so I guess I don't know when the penalties would kick in, but if one person got mailed somebody else's health information, we wouldn't have to report that, but we would have to tell the person whose information went to the wrong place,
Well,
right?
we would tell the person, and at the end of the year, we have to fill out a survey, if you will, with the government where we have to report all of the breaches that we know about. So we would tell the federal government about that as well. You really start getting the penalties involved when you are knowingly going out of the way to create a violation. For example, if I knew that it's illegal for me to log on into your ID, I know that. But if I proactively went out and started asking people to give me their IDs and passwords, and I started logging into the system and collecting this information, and then I got caught with all of this data, that's a very deliberate attempt.
Right.
And then there could be some very significant penalties assigned to that. But if
It's inadvertent.
if there's an inadvertent exposure, like the mailing, that is probably going to be okay. If you have a mailing, every time you have a mailing you have a problem, they're going to come after you. You've got to fix your
I
process.
hope we don't.
But we don't. We don't. But those are just examples of things that can happen.
So we try to do everything we can to keep something confidential. But even in somebody coming to the clinic and being in our clinic, and their neighbor sitting in the same, or friends or somebody who knows them is sitting in the same waiting room, and we call their name, the person's name, and then the other person knows they're there. They don't see the doctor. I mean, you can't avoid that. That's inadvertent.
Yep. There's nothing you can do. You have to take reasonable precautions. If you can do something about it, you should. If you can't, or it's unreasonable to expect it, then you don't have to.
Or for instance, if somebody's hard of hearing and the doctor in the next room, you're waiting in one room and the doctor in the next room is yelling so that the patient can understand what's going on or asking questions, and they'll probably could hear that, and then they could see who came out of there, and okay. So there's going to be some inadvertent
disclosures of information. Yeah.
And they're probably not that important.
Not in the whole scheme of things, no. We want to try to do what we can to minimize that.
Right.
But you can't stop all of it.
So in some of these cases that we're seeing here with these stolen laptop computers, what should they have done differently? I mean, number one, you don't leave a laptop in a car to be stolen.
No, you don't. There's a few things that you can do. What we're trying to do is, first of all, don't allow this situation to occur in the first place. Be proactive. Don't let information get put on that laptop. But there are times when you need to put information on a laptop because you need to go someplace and you need the information and you can't get it any other way.
For instance, a specialist, and they know who they're seeing and they need their information, but they may not be able to log in, so they have it in their computer that they carry with them. Is that what you're talking about?
Exactly. Okay. Yep. And even in many of these cases, they may need to have that information with them to do what they're doing. And they may have the legal right to have that information as well. But if you're going to have it, and you're going to store it someplace, you need to encrypt it.
Encrypt it.
Yeah. That's also a new thing with the federal legislation. It's not a breach unless the information is considered unprotected.
So it has to be easily accessible, the information on the laptop. So if it's encrypted, what does that mean?
Well, encryption is a way to change the data using some mathematical algorithms so that looking at them, you're not going to know what it is. And unless you know the key, you can't reverse the mathematical algorithm to put that information back into a form where it is readable.
Readable, okay.
And the federal government has several encryption techniques that are readily available and easy to use, but very complicated to break.
Okay, that was my next question about hacking.
Yes. There are a number of encryption techniques that are very easy to hack. When you think about encryption, you can if you go back to, I think it was World War II, I'm sorry, War with Japan. The reason we beat the Japanese was largely because we intercepted a communication from the Japanese that was encrypted, but we knew the key. Yeah. And so we unencrypted the key and we knew where they were going to be at a point in time, and we were able to capture them before they were able to do harm. You have to have a very strong key. It has to be kept private. The better systems use two keys, where you have a key and I have a key, and the only person who can read this is the one who knows both keys. Oh. So you have a public key, and I have a private key, and I have a private key, and you have a public key. So I send it to you with your public key because you make that publicly known, and my private key, and you decrypt it with my public key and your private key, and the mathematics work their magic, and only you and I can see that message, and nobody else unless they know all these keys. And these keys are usually 2,000 characters long, and so it takes a computer to do it.
Wow.
And
You
the
just,
math is really simple.
do you type it in? Or?
No, those keys are usually stored as a file someplace in the computer, and you have to protect those keys. To
Sounds
really
complicated
do it right,
to me.
it can be very complicated.
All
But
right.
using it, there are software packages that try to make it easy.
Simple or easier.
Yeah.
So basically, people that have healthcare information on their computers, and it should be encrypted.
It should be encrypted.
So that
I'd say not
if
even
somebody
just
stole
healthcare.
it, they can't hack it. They can't get at
Yep.
it.
Yep. And I'd say not even healthcare information. Any
Anything.
personal, confidential information that you're going to store someplace should be encrypted, just to protect yourself.
So even corporate information, they may want to encrypt.
Even at home.
At home.
Do you have a computer? Do you store bank statements? Do you store any financial information about your family? Social security numbers? Any information that you make? You have a little message file that says, here's my passwords to get into all my different computer systems.
Yeah, yeah.
You know, that's confidential information. If it's not encrypted and I stole your computer from your home,
To be right there.
I would be able to get into all of your stuff. And that happened a couple of years ago. Someone had a bunch of stuff on their computer at home from work. Not here, but at a different company.
It was
And
healthcare
someone-
stuff, or
I don't think it was healthcare. But someone broke into the house, stole the computer, and all this company's information was now exposed
out there.
out there.
Interesting.
It wasn't encrypted.
Now, speaking about criminals, some of the things that astound me is we have people that come in to the clinic and get care under somebody else's name.
Yes, there's a lot of that going on.
That type of fraud just is amazing to me. Just the gall of something like that. But these people somehow get access to people's names, maybe their birth dates, maybe their social security, maybe their health plan and their group numbers, all that kind of stuff. And they're able to fraudulently use that to get access to health care. It's not like they're getting money, but they'll get tests, or they'll go see the doctor, or
It's
get
as good as
medication.
money.
Yeah, I
Because someone
suppose.
else is paying the bill.
Yeah. How do they get that?
Well, there's a whole topic called social engineering. A lot of it would be just, I'll pick up the phone and say, hi, I want to speak to a doctor. And they say, well, which doctor do you want? Oh, I don't care. I don't know. Just give me one. Well, let me connect you to Dr. Adorn. Well, even that little bit right there. Now, when you pick up the phone, I know your name. I didn't know your name before I talked to the person.
Okay.
And so now when you answer the phone, it's like, hey, Dr. Adorn, remember me? No, not really. And we start,
Right.
There are people who just really are good at conning other people and getting information from them.
Extracting information.
Yep. They have that. There are all kinds of schemes, spam and email schemes, where I'll just generate a whole bunch of email and send it out to a whole bunch of fictitious, made-up names. And any of them that get rejected, I know are bad. But if I don't get a rejection, then I know there's a valid
There's a
email
live
address.
person
There's
right
an
there.
email address there that I can start sending real things to. And there are people who will buy that.
And they'll release information, or they'll be able to get
Oh,
information.
yeah. I just go do this, and I find all these good email addresses, and then I sell them to criminals who want to use them on the street.
Oh my goodness. And they're able to access, people will give out personal information. Is that called phishing?
Yes. Now with the F, with the
With the P.
P. Phishing
Right.
with the P. Yes.
Phishing with the P. So it's the ability to just extract from people, because people are letting out information that they shouldn't be, basically.
How many times have you got an email that said, oh, we had a problem processing your bank transaction the other day. Please log on to this site so that we can get it corrected. So you go out to this site, it looks like your bank, so you type in your bank ID and your bank password,
Oh my goodness.
and now I know what your bank ID and password is to get into your account, and I can go steal it.
Be pretty tricky. And so that's what some people are doing. They're able to get access to enough information so that they can use that information, healthcare information, so they can get in to see a doctor and get a prescription or get labs without having to pay for it.
Absolutely. And the narcotics market is huge with that, because these people don't even need those drugs, but they want to come in and they want to get them so that they can then turn around and sell them.
And we never have their real name.
And we never know who they really are. We think they're a patient who really needs this treatment, and they're stealing a needed medication from somebody and turning around and selling it for profit to someone else.
Wow.
It's
It
a
even goes
travesty.
that far. I can't believe how devious and tricky some people are. It's an eye opener.
Yes, there's a lot of
me.
problems out there.
So be careful about releasing any of your healthcare information over the computer because it can be used against you, just like a credit card. So if you gave away your credit card number by accident or somebody stole it by accident, it's the same thing for healthcare information. If you give away your name and the insurance company and maybe the group number that you're under, they can come in under your name.
Yep.
And charge you a bill.
This time of year is especially a problem with that, because you mentioned credit cards. There are people who mailbox walkers. And this time of year, everybody's getting their new insurance cards. So I take a sweep through the neighborhood and I open up the mailboxes and, oh, look, there's a big package from Health Partners. Here's a big package from Alina.
And all the numbers are in there.
All your information for your member ID, your carrier ID. I can walk in now with your member card and say, hey, I'm Dr. Adorn. I need benefits.
That's incredible. That's incredible.
So we have to put things in place to make sure that we really know who you are. Photo ID, other forms of ID than just that card. But if you do go someplace and you have that card, there will be people who will give you treatment. But be careful.
Well, this is a very interesting show today, Steve. Thank you for being on the show. Thank you for watching. I'm Steve Adorn, and protect your computer information, protect your healthcare information. And I hope this has been helpful for you. Thank you very much.
Thank you.